Hey everyone, my name is Mrs. D with MA Nursing Tutoring, and today I have an NCLEX question that we're going to go over together. So here we have this question, and it says, a client has a history of IV drug use and presents with fever, fatigue, and a new heart murmur. What complications should the nurse suspect? Now let's pause for a second and think this one through. One thing that NCLEX loves to do is list a whole lot of symptoms and expects you to know what that disorder is. One of the things I saw when people were answering this question is focusing on very common symptoms. But one of the NCLEX tips I love to tell my clients is you're not looking at the similar symptoms that 10 million different disorders have, like fatigue. Almost every disorder has fatigue, right? Fever, 10 million things have fever. Pain, almost everything has pain, right? What you're looking for is what we call key findings. And the key finding in this question was a new heart murmur. That means that the patient didn't have this before, right? Now, again, fatigue and fever, almost anything and everything has that. That's not going to help you. But this is what we call differential diagnosis, right? And again, we as nurses don't diagnose, but you got to know it in your brain. So this new heart murmur is going to help you eliminate options. Let's go through it. Hepatitis B, pulmonary embolism, meningitis, and endocarditis. Now, let's start by stating the obvious. We know that a lot of these can cause fever and fatigue, right? Such as hepatitis B and meningitis. However, do they cause a murmur? They don't. So in this case, we're going to eliminate A and C because A and C doesn't cause a new heart murmur. Now, a pulmonary embolism and endocarditis, really close options, really good options, right? But if you remember about endocarditis, it's an infectious process and the strep travels to the valves and calcifies the valves. And that valve calcification is what causes that heart murmur. Whereas pulmonary embolism, you're more likely to have chest pain, okay? Not so much a new heart murmur. So in this case, we're going to eliminate pulmonary embolism because it doesn't cause new heart murmurs. They typically cause chest pain and trouble breathing. Whereas endocarditis, D, is caused by an infectious process that strep breaks off, travels to the valve of the heart, calcifies there, that causes stenosis, prevents the valves from opening and closing properly, and therefore you have a heart murmur. I hope this was helpful. Follow, like, and subscribe for more, and I hope to see you on the next video.